What really was the turning point for me in this journey was actually practicing menstrual cycle awareness. That's where it all really kicked off, because you cannot heal a body that you hate. It's as simple as that. When you hate your body, when you are at war with your body, you cannot work with your body and heal your body. And I think something that is so valid and so fair and so much a part of my experience, this endo warrior experience, is that we are warriors. And my God, we are. We have to fight all the time. But that really left me with this feeling of, my body's against me. My body is at war with me. Once I started practicing menstrual cycle awareness, and once I started, just a small act of sending my womb love was just such a pivotal moment for me, because it really changed the way that I worked with my body.
Welcome to the Wildflow podcast with me, Charlotte Puanto, an award-winning menstrual cycle coach and priestess, and the founder of First Moon Circle School. I guide women to honor and embrace their sacred cycles in their life, leadership, and business. Let's say hi to more ease and flow by co-creating with your body, and goodbye to struggle and burnout. This podcast features soul-enriching conversations, inspiring you to love your cycle, lead as a sacred leader, and grow a life and business that serves you by harnessing cyclical life and business practices. Join me and other changemakers, thought leaders, and wise women to embrace and embody your wild flow. Endometriosis is a chronic health condition that causes unimaginable pain and suffering that takes an average of 7 years to get diagnosed because of a huge long-term lack of understanding of what it is and how it works, especially in the medical community. Sufferers struggle to get support and help for their pain, let alone to have understanding and empathy and support, even by doctors and therefore by friends and family and in the workplace. Together, this causes major consequences for sufferers' quality of life. Amy Russell is my guest on Wild Flow, and she's here to help women take a different approach to healing and living with endo. Instead of having to become an endo warrior fighting against your body and the system, Amy guides women to understand, nurture, and transform their relationship to their endometriosis and develop a powerful toolkit that helps women to be with themselves as their own best advocate and support, even during flare-ups. Amy's a certified menstrual cycle coach, circle facilitator, and passionate advocate for women's health. Her journey began with her own struggles and discoveries about menstrual health, leading her to a deeper understanding of her body's natural rhythms. Through her work, she helps women deeply and shamelessly explore the joys and shadows of their cycles, to play, heal, and find joy in what once felt like a burden, and to be comfortable with the ebbs and flows that are woven into our menstrual cycles. Amy shares in this episode her journey from discovering that she has endometriosis and what it's been like for her to try to get help through the system, and then how she discovered alternative approaches that work in the body, mind, and spirit plane to healing. She's sharing the work that she does with women and how powerful this is, how empowering to be able to take back what is gaslit and misunderstood and excused as women being irrational and emotional and just complaining about everyday period pain. This is a really important conversation for anyone who lives with endometriosis to listen to find hope, to find solidarity, to understand that there are alternative ways of working with your endometriosis. It's important for anyone who supports people with periods as well to have an understanding and appreciation of endometriosis and what it's like to live with it. And I think it's just important in general for us all to listen to, for anyone who's ever been gaslit, for anyone who's ever struggled to be heard and supported and understood with what it's like to have a menstrual cycle or to be perceived as a woman in this world. And I think that it's really powerful to hear these stories of healing and transformation and reclamation of what can be a terribly painful situation, but to turn it into something that is a portal to healing. Hi, Amy. Welcome to Wildflow. It's so good to have you with me today. How are you?
Hi. I'm so good, Charlotte. Thank you for having me. I'm so happy to see your face and feeling really nice after just having a catch up.
No. Yeah, me too. We just had a little breath together and a little check-in because, it's so interesting the way that we do our best to work with our cycles and be present with ourselves, but shit happens and we just needed a moment together to just breathe and drop into presence together today. So let's share from that place. Amy, let's do a cycle check in. I'll just share
Sure.
first and then I'll invite you to share yours. So, for me, I'm on cycle day 6 and I finished bleeding just about. I've had a pretty heavy bleed actually, but it was good because for a while I've been having lots of spotting beforehand and kind of like slow, not even spotting, but just like slow to evacuate the building. Like it's like, oh, it gets started and then it's sort of like, come on, come on. It takes its time and then like woof, like the gates
Yeah.
open on like day 3. And it's that's given me quite a lot of cramping to get to that kind of openness and releasing. Whereas this time it was just a full flow right from the start, which was really, really nice, but I was still quite crampy actually. And yeah, so I think I can't even remember now. It's like this bleed's just been like a portal into another world. Kind of don't know where I've been. And so I can't remember how many days my last cycle was, but I think it was just over 30. So yeah, it's sort of been a bit trippy, but really potent. Just feel I've been having really crazy dreams and just had a weekend at my mother-in-law's, just helping
Mm.
her clear her house. So it's been really quite full on, really quite, not like I could just sit there and put my feet up and cocoon, but at the same time, really found ways and pockets of time and space to be with what's coming through. And yeah, I'm a real dreamer. So I have like really vivid, psychic, lucid dreams that I'm just like, whoa, when I wake up, it's like I've just lived in a parallel universe or something. So I'm feeling like a little bit of a rise. Well, sort of, yeah, a little bit of perkiness starting to come through, but still quite in my like, slow, steady phase. So I feel like it's a transitional point, but the rise hasn't really begun yet. So just honoring my kind of slowness, and I'm feeling a little bit vague, I think, as well, and just holding a few things going on in my family life too. But so excited to be here with you, Amy. So let's hear from you. Tell us, what's your cycle check in? Where are you at today? Whether you know exactly where in your cycle you're at, or just what kind of seasonal or energy you've got, and just what's that like for you today in this moment?
Thank you. So I'm on cycle day 10 today, which is typically one of the harder days of my cycle. So days 7 to 10 for me, I feel just so raw and vulnerable and like just cracked open. But also, I feel angry. And, like it's really riddled with anxiety these 3 days. And I've actually been really struggling with this cycle so far. I started day 1 at work. I wasn't able to take that break. So I was really pissed off. Like, how dare you roasting me on? And, I had to go because, bills and such. And I feel like, yeah, just from that, it was just like because I couldn't rest, I was cramping. I've had contractors in my house for the past week, in and out, ripping up my bathroom floor. I've had my brother move up from New South Wales, move into my house, which has been a lot. And I've just not been myself. And last night I woke up at 1 a.m. and was really sick all through the night. So this morning, obviously, I woke up feeling very just tender and emotional and all over the place. So I turned to menstrual cycle awareness and did a little quick check in with myself and just remembered, yeah, how important it is for me to be here today, how much I want to be here today, and how much it means for me to show up and be here. So I'm just writing that and remembering my why and not the nausea in my stomach.
Mm.
So yeah.
Thank you so much for just sharing the absolute realness of your check-in today. I just appreciate that so much. And I think everyone will too, because you're not giving us the shiny highlight version. You're telling us the truth of it, like where you're at and those certain events and situations as well that have led to your experience of your cycle so far being challenging for you, and those emotions, particularly anger coming up. And that is true. It does, these things do show up in our bleed and in our cycle. And then just really hearing you and what happened for you overnight, and just really admiring the way that you sat with that, and you're not here out of can't let you down, can't disappoint, can't say no, but you're here having really listened to yourself, checked in with yourself, asked yourself what's real, what the calling is it actually you really just can't be here, or actually I want to be here, like this is like nourishment for you, this is healing for you, this is where you want to be and what you want to talk about. So like just discerning that difference and tuning inwards through your cycle awareness practice, I just think is beautiful. And for other people to hear that as well, and to question, where am I being the good girl, people pleaser, can't break the rules, or where am I like standing in my power over this? And yes, I'm feeling these things. No, it's not perfect, but I'm here and I'm real. And we're going to have this conversation.
Yeah. I think it's really important to just to quickly touch on that, to just be okay with accidentally playing into the big girl. Like you asked me how I was when we started this, and I went, "Yeah, really good." And then went, "Oh my God, no, I'm not." And it's just such a reaction, isn't it? And it's like, it's not something you can just switch off. And yeah, if you really commit to just removing yourself from those and really honoring where you are, it's not something that just happened. It's something that I practiced constantly over years. So yeah, just
Mhm.
touching on that because it's
Love
so
that.
easy to get caught up.
Same here. We don't just go, no more, I'm done with that. Like we could say
Mm,
that, but the actual like embodiment of that is an ongoing process. And I think what you said there is super important, because like there's times when I do that too, for sure. I'm like, oh, like me, let's fit in, got to do the right thing. And then it's that, hang on a minute, actually, is this true for me? And that's the practice, that's the work. It's not like never falling into those old patterns. It's recognizing when we do and making that choice in the moment. Okay, which path am I going to follow? Love that you touched on that. Hmm. So we're here today to talk about your experience living with endometriosis and how that has become really the focus of your work and the gift and the medicine that you hold, and you're here to offer women to in their own healing journey as well, because you take an approach that is just really powerful and so needed and different to the mainstream. And we're going to get into all of this. So, for anyone listening who has endometriosis, this is absolutely an episode for you. And, even if you suspect that you might, then again, for you, but also anybody at all. I think this just is going to be such a powerful conversation more widely for anybody who is just, I think this is everyone, right? Just in that place of learning to trust our bodies, learning to trust ourselves in our inner knowing and our own judgment, standing up for ourselves, advocacy, I'm sure is going to come into this conversation. But when we all just so gaslit and told to suck it up in so many ways, in so many different parts of our
yeah.
experience of being a woman in this life, I just know that this is going to be really powerful and full of insights for all of us in different ways. So, Amy,
Mm.
I'd love to just start with asking you, you might want to share for anyone who's not sure what endometriosis is, but how did you discover, what was your story like, your experience of discovering that you have endometriosis?
Sure. I'm really loving as well that you touched on this side of this mental battle with that. And I'm really excited to go into it because truly it is one of the biggest battles ahead. whether you have like from pelvic pain starting to a diagnosis or to, not being diagnosed, whatever your journey may be, the mental side of it and the fight is just still something that I struggle even now to come to terms with after all these years. But let's start with what it is. Endometriosis. So it's a chronic disease which affects around roughly 190 million women and people who bleed around the world, and about 830,000 of those are here in Australia. So obviously really common. And these are the people who have been diagnosed. So what it is it's when tissue similar to the uterus lining, the endometrial tissue, is found outside of the uterus. So it can travel. Originally, everybody kind of thought that it was just kind of secluded to your womb area, but it can actually really travel around the body. And this is where it's really important to understand that it is a whole body disease. It's not just, it's not just a bad period. It's not just hormone related. It is a whole body disease. It can be found outside the womb on the ligaments that hold the womb in place, on your ovaries, your bladder, your intestines, your kidney, your lungs, your diaphragm. And recently they've discovered you can even find it on your sinuses, like the cells, the sinuses, and the brain. So it's pretty serious. And this is why we call it a chronic disease, because it's fucking chronic.
Yeah.
And, it's like I said, it's affecting so many people. And I feel like a lot of people are just focusing on a very small part of this. So how it happens, the most widely accepted theory anyway of how it's caused, it's by something called retrograde menstruation, which you may have heard of. So what that is where when we're bleeding, our uterus is contracting. And instead of sending the blood down, it can actually send it up and backwards and into the fallopian tubes. And then it'll kind of escape out via the side of the ovary and then into the pelvic area. So that's not actually a huge problem. 19% of people are experiencing this. Where the problem begins is when the immune system is dysfunctioning, because our immune system comes through and it gets rid of these little cells before they have time to kind of land and stick. Once they land and stick, then they're kind of fueled by a multitude of different factors. One of them, yes, being your hormones, estrogen, to grow. So that's really where the difference is. It's not our periods, it's not our hormones. It really comes down to what our immune system is doing if it's dysfunctioning. And that's not the only way. So there are, from what I've researched, there are, a few things that can cause these lesions to grow and to stick, etc. So firstly, it can be like it's a bone chart in utero. So, when your mum was pregnant and you were in utero, exposure to chemicals and toxins and all these things, inflammation is a huge, huge part of this disease. Like I said, your immune system, its reactions, hormonal imbalance, and environmental factors, things like smoking and drinking, and your diet, and are you eating inflammatory foods, things like this, and of course our endocrine disruptors, which is again all those things that can really put our hormones out of balance long term. And lastly, one of the closely related ones is actually the gut microbiome. So that is a huge one too. And a lot of the time, what I've been reading, doctors and listening to people who have these patients coming in and seeing them, it's all really starting with these gut issues first. These are the issues presenting first. And so that's really interesting to me. It's a whole body disease. And we're going into doctor's office and saying, hey, we're in pain. We've got these symptoms. We need this help. And they're going, okay, great. Here's the pill. Shut your hormones off because it's hormone driven. A lot of people are actually suffering through other factors. It's not just their estrogen. They're not presenting with high levels of estrogen. So essentially, to shut it down, it's not a good long-term treatment and it's not for everybody. And I think, yeah, that was something I really wanted to touch on because that was what was thrown at me. So my story with this started at 14, just like, other people, first period. Your first period is when it kind of all starts. And for me, it was so painful. And I was told it was normal by my mother, my grandmother, the doctor. Tried to put me on the pill, didn't work for me. Thank the gods. Didn't work for me. And I was really ill. And so my mum said, no, we're not going to do that anymore. And then, so I just kind of suffered for the next, what was that, 14, for the next 5 or so years until it became so life debilitating and so horrific that I went back to doctors and said, please help, can we do anything for this? To which they did blood tests, told me they were normal, told me the pain was in my head, sent me off with the NuvaRing. So I used the NuvaRing for about 8 years or so, which for anyone who doesn't know, it's like, I always refer to it as like a little glow sticks that you put around your arm. It's kind of like that, but smaller, and it just is inserted into the vagina and sits there. Not great. Not great at all. I later found out as well that it was killing women. Like, there were legal battles in the States, and yeah, it was actually really bad for me. The reason I even stopped taking it was because I forgot to put it in 1 month, and I wasn't crazy for that month.
Ah,
And I thought, well, hang on, why did I feel so good? What changed? Oh, I didn't put my NuvaRing in. So I thought, okay, maybe I'll just not take it for the next month. And again, it wasn't crazy. And then I thought, okay, I'm going to stop taking that now,
hmm
which led to obviously a lot of other problems in doctors' offices, because when you tell them that you don't want to use hormonal methods, because we all know, right, how important estrogen is for our overall health and well-being, our bones, our skin, like, that's not something I'm comfortable with. And then you kind of get that, well, I'm quoting here, if you're not prepared to help yourself, I can't help you either.
it's outrageous. It makes my blood boil. Oh, I'm just so sorry you
Yeah.
had that experience. I had like I don't have endometriosis, and I had a similar thing said to me, but about contraception, because I said I don't want to have another child, but I absolutely point blank refused to take hormonal contraception. And I basically just got told, well, that's that's the risk that you've got to be willing to take then, because basically I wouldn't be able to control my fertility any other way. And I was stupid for basically even questioning
Mm.
their process. So
Mm.
yeah, I mean, and that's not even coming from a place of pain and suffering in the way that you're describing. I just think that's disgusting, but it's so common, right?
It is. And it's not even the worst things.
hmm
you know, it's looking back at my experience, and I feel like a lot of people will be experiencing this because a lot of the time, the majority anyway, when, we're starting to experience these symptoms is kind of teens, late teens, early 20s. And we're still very much in our maiden selves. We're still very much in, we can trust our doctors. They know what's right for us. They're here to help us. And then, you go in and you say, I'm in pain. I need help. They don't give it to you. They do a blood test. They tell you that your labs are normal. They tell you it's in your head. They offer you antidepressants. Meanwhile, you've been in hospital every single period, screaming out in pain for the last, couple of years. And sometimes in between the periods, like the amount of times I've been in hospital, I am well versed. Like, it really is incredible. And the struggle of going to the hospital already in the pain that you are. And when I was doing it, I was living by myself in the city of Melbourne. But getting myself to a hospital in that much pain on a bloody tram was one thing in itself. To get to the hospital, to then be told, even though I quite literally am crying, screaming, and can't walk, to be told, look, just wait in the waiting room. Then 7 or 8 hours later, to finally be seen, to be then told, well, we can't help you. There's nothing wrong. Repeatedly really does something to you, and it really separates you from your sense of self, from your trust in self, trust in your body, because you're like, I'm trying to help. They're doing scans, they're doing blood tests. It must be me. It must be in my head. And that is super fucking dangerous for anyone. And that's why we're all so desperate to get this validation, which is the surgery, the diagnostic oh, the diagnostic
Laparoscopy.
lap surgery. Yes,
Yeah.
that's the one.
Keep going.
Yeah. And that's really something that we're now all really aiming for. I know I certainly did. It was something I had to fight for. And even looking back at the doctor's notes that said, have explained to patient That chance of endometriosis is very small. Patient refuses to accept this and wants surgery. And thank God, because they found kind of endometriosis lesions. So if I had just rolled over, I wouldn't have been diagnosed.
Mhm.
And yeah, it's a battle and a fight, unfortunately. But what I've really learned through all of this battling, through all of this work with menstrual cycle awareness as well, is that that is not a solution. It's not a treatment. It's marketed as a treatment, right? Like, come get the surgery. We'll fix your pain. We'll diagnose you first and foremost. We'll fix your pain, send you on your way. You take some hormonal treatment, and then you should be good. Why are you back in my office a year later? You should be fixed, right? But that is not the case. So the gold standard right now, I'm air quoting everyone, treatment
Mhm.
is excision surgery or ablation. So you've got excision or ablation. Now, I had ablation. I've had that twice. So the difference between the two, it's believed that excision is better for many reasons, but ablation is essentially where it's less invasive, but they open you up a couple of times, keyhole surgery, moving around your organs. So sometimes they actually have to cut ligaments to get into where they need to go, which is not explained to us in the process at all. It's just marketed
Wow.
as it's a really simple procedure, but upon
Mhm.
further investigation, it's much more than they're kind of letting on. So they go in and they laser off the endometrial lesions, but however, what that's doing is leaving the root behind.
Mm.
Ligaments continue to regrow, but in doing that, they're actually causing scar tissue, which gives us pain. So that's not good. People are coming back to the doctor's office 3 or 4 months later saying, I'm in worse pain than before the surgery. And this is super common. So that is not, for me, that is not viable as
Yeah.
anything more than diagnostic.
Yeah.
So it's the only real way. If anyone out there listening has been told by their doctor to go and get a scan, whether it's MRI or transvaginal, and from that they have said, no, there's no endometriosis, you need to get a second, because the only endometriosis that can be picked up on a scan is like stage 4, completely riddled, like fusing your organs together almost. Anything
Mhm.
beyond that needs a surgery to be diagnosed. So then you've also got that excision, sorry, which is where it's a bit more invasive. It's done by an endosurgeon specialist, which I think is really important when seeking help. And they go in and they actually remove those lesions. That does have a longer relief time frame, but only 40% of women who have had surgeries actually reduce their pain overall. So that's, 60% less of us. We're back within the first year saying we're still in pain. And they're saying, well, should be sorted by now. Again, the whole
Wow.
body disease.
Yeah. The whole body disease. And they're only going into the pelvis, so they're not getting access to anything that's anywhere else. They're not taking out the root cause. They're creating more
They're not working with
inflammation.
the root cause either. Yeah.
Yeah. Hey, lovely. While we're here, do you know what your secret cycle superpower is? If not, I'd really love to share with you my quiz, which will help you to discover exactly that. You will learn which part of your cycle you thrive in, where your strengths and gifts lie, as well as what your vulnerabilities actually are, the shadows that you cannot see, and how to really nurture them and nourish them so that you are reclaiming your power, you have confidence and strength, and you feel your best all cycle long. You're going to learn tools, techniques, and practices to balance your energy, get grounded, and love your cycle so you can be your best in life, in love, and in your business. If you don't have a menstrual cycle, come and take the quiz because it will work with the moon cycle and show you which phase of the creative and business cycle you struggle with most and where your natural gifts lie. Discover your primary archetype now. Are you the muse, the connector, the challenger, or the mystic? I'd love to know. Gosh, that's horrifying to hear. Thanks for explaining that. It takes so much blood, sweat, and tears to get diagnosed. I'm really curious then, Amy, what is it for you that has helped you to find some healing with your endometriosis?
It took years and years for me to get to a place where I am now of my endometriosis, which is Mostly acceptance. But I think what really was the turning point for me in this journey was actually practicing menstrual cycle awareness. That's where it all really kicked off because you cannot heal a body that you hate. It's as simple as that. When you hate your body, when you are at war with your body, you cannot work with your body and heal your body. And I think something that is so valid and so fair and so much a part of my experience, this endo warrior experience, is that we are warriors. And my God, we are. We have to fight all the time. But that really left me with this feeling of, my body is against me. My body is at war with me. And that's what I accepted. My body just railroads my experience of life. And once I started practicing menstrual cycle awareness, and once I started just a small act of sending my womb and my uterus and all of my organs and things, this love was just such a pivotal moment for me because it really changed the way that I worked with my body. So that was really the beginning of me. It was definitely healing. It was learning to stop hating my body, to stop wanting to just have a hysterectomy and be done with it. And obviously from there and through practicing menstrual cycle awareness, I've been able to really get to know my body, my triggers. I've been able to turn around and say, I'm really stressed this week. That probably means that next week, when I click into my luteal, I might actually have some pain coming into my period. What days will that be? Okay, maybe on those days I'll take off work and I'll rest. And I think really like forming a relationship with my period was a really big one for me as well, because I went from really hating it and really being in pain to be able to really sit with it, to instead of turn away from the pain and turn away from the messages essentially that my body's trying to send me, I took the time to sit with it, to sit with my pain and to ask my body, what are you trying to tell me? I really believe my body was trying to tell me all those years that I was suffering so immensely. I was not taking care of myself, mostly because I didn't know how. Because no one taught us to, right? We're not little men. Like we are so multifaceted. And just that simple act of learning how to take care of myself, which looked like taking 2 days off work. And I know this isn't possible for everybody, but even finding times within those days to rest, to stop, my pain would actually ease as soon as I rested, as soon as I nourished my body with, all of the nutrients that I really needed around that time, my pain lessened. When I stopped using tampons and inserting things into my vagina when I was bleeding, my cramps stopped. And this really got me thinking, okay, like what else can I do? What other relationships can I make with my body, with how I live with my endometriosis to get to a point where I guess I can live relatively symptom free.
Wow. Thanks for sharing
Yeah.
that, Amy. That's incredible. Thanks for sharing some examples there of the questions that came up for you and the things that you were noticing in your day-to-day experience and going, aha, like that helped a little bit. And, whether it's a practical thing like not using tampons. And I found that too. I used to get so much pain with cramping when I would use tampons and even a menstrual cup. And the moment I
Yeah.
stopped, it's like, oh, my body can just flow and relax. And there's no like tension there from that holding something in. But I
And
really
that's
love what you
really
said
real.
there. Mm,
Yeah. Even
it,
though a cup is better,
it
that pressure, on the vaginal wall and even the insertion and the removing, it's still scraping, it's still upsetting. And for people who are really sensitive in that time, people who have pelvic pain or endometriosis or what have you, that I think, yeah, it's something that we really need to think about if it's something that we really want to be doing to that sacred area in that sacred time.
yeah.
It's not wrong by any means, but it's definitely something to consider.
Yeah, I agree. And it's not wrong and everyone has their own personal choice. But yet if you are suffering with the pain and cramping, like I've found that just using period pants, period underwear, just so much better because Like, yes, it means you will contact your blood, like you can smell it and you can see it and all of that. But I think that's a really powerful thing in itself, to not be disgusted by your blood, but to just let it
Yes.
flow. Like, I just feel so much more comfortable with that. And I'm really moved with what you said. Once I started sending my womb some love, it really changed the way that I work with my body. It stopped you wanting a hysterectomy and wanting to
Mm.
just be done with it. Like, that side of things, like,
It's huge.
the attitude and how we feel about our body really does communicate to our body, on an energetic level, but also, it's science. It's like
Yeah.
biology,
This woo
our
woo.
body. Yeah, it's not witchcraft. Like, the
Yeah.
way our body responds to the environment, and our feelings create that environment as well. So our body attunes to our nervous system and adapts. And, even on the unconscious level, like, there's so much that goes on in our body on the subtle levels, that's to do with, how we feel about our body then informs our body, the like how to respond, how to feel, how safe we are. And we can create symptoms in our body based on that. And I'm not saying that we're creating our own endometriosis, but I'm saying that, I'm really connecting with what you said there about our relationship to our body and the act of sending yourself some love, as well as things like resting and nourishing yourself when you feel that, hey, hang on, I'm coming up to this point in my cycle where I might be experiencing symptoms typically. So I'm going to prepare for that, or like shift your schedule, or just make some tweaks to what you're doing and how you're living in the micro moments, even without it being, a full scale. This entire week is going to be, it's like, what can you do in those pockets of space to
And I
just
think
look
that's
after
really,
yourself?
it's so undervalued. It really is. There's even been studies done now, and like this is a hard conversation to have with yourself, Charlotte. Don't get me wrong. It is not easy to say, I might be making my pain worse. It doesn't mean that I'm a bad person. It doesn't mean that I want pain. But I got to tell you, every time I felt that pain, this isn't anymore, but every time I used to feel my pain, it was a validation. And that is a really vulnerable thing to admit, but it was. It means that all those times I ended up in the hospital, I was right. It means that when I missed on my friend's birthday, I was right. When I couldn't put a smile on, when I couldn't go to work, and I was a shit employee because I was hardly ever at work at one point, and a shit friend, and I'm angry because I'm always in pain, and all of these things. Like, oh, I just lost my train of thought. Oh
You're
yeah,
saying you're not
yeah.
a
So
bad
yeah,
person.
right, yeah. But it's so fair, especially in the position that people are put in the medical system, especially with quote female vagina problems. I think again, it's there. It's important to. Oh yeah, I think that's really valid for us to want to be validated, and I
Yeah.
think it's so important. And I still remember waking up from my first surgery. The first words coming out of my mouth were, "Did you find it?"
Mm.
I was like, I was still barely conscious. Did you find it? And I just heard, yes, honey, we found it. And I remember in my state bursting into tears. It's still an emotional moment because every single time that it was ruining freaking life, it's validated. And so I think that's something to think about. But again, these things can be accidentally making it worse, like our pain pathways, the way that our nervous system is like really good at creating more pain
Mm.
once it's created it. So that, like I was trying to say before I went on to rampage, there are studies now where they've gone and they've made people like over a period of time, they've got them to do exercises to get them to feel safe in their body.
Mm-hmm.
And
Mm.
naturally, the results of that were mind blowing to everybody because they were, oh, this really works. Their pain lessened, but I think it was like 80%. That's
Wow,
not a small, that's
80%.
That is not a small thing. My source of this, it was a podcast that I listened to. Red School interviewed Dr. Peter Wright. I think her name's Dr. Peter Wright, Healing Pelvic Pain. She's
Yeah.
been my Bible really for a lot of this work. Yeah, and she was talking about that, and I was just like, oh my God, like we are just looking at this the wrong way. I believe that we need a surgery to diagnose so that we are able to know what's going on with our body and work with our body. But I just don't think it's like this mad rush now for everybody to go and get a surgery. And actually, 6 out of 10 women and people who bleed who are having these surgeries, diagnostic surgeries, they're actually finding that there is no endometriosis, which is awful, obviously, in a sense, because then they're back to square one. What is my pain?
Yeah.
But in the other sense, then you get the diagnosis. Okay, well, go on a pill or, take some incredibly impactful medication that's going to really mess you up.
Mm.
And, that's it. See ya. There's no, you can work with this. There's no, you can heal yourself. There's no, through the right diet and exercise, you can minimize. It's just, well, if you're not willing to help yourself, have a baby, have a hysterectomy. Two things that don't actually work at all for curing endometriosis.
And yet are like life alteringly, permanently significant.
Yeah. At
Yeah.
19 years old, I was told by my surgeon, just have a baby. I was single and 19.
That's outrageous. Outrageous. Wow. I'm really interested in that, that work about meeting your pain and being with your pain and, all of that work that we can do to really reconnect with our bodies and find safety in our bodies. And I just think that is, it's more trauma informed as long as it is facilitated right, obviously. But that's the empowerment, because it's like, well, we don't have to rely on all of these, terrible, actually
And
medical
extreme.
processes that are so extreme that the rates aren't very high when it comes to success outcomes. And just, either it can be validating, but then, like you say, what next? Or totally invalidating and gaslighting when it's not found, and then you're left stuck anyway. So
With no answer.
no
Yeah.
answers and no way
Yeah.
forwards. So Amy, I'd love to hear about, how this has become your body of work and how you support women to work with, heal, embrace whatever that is, as you describe it, with that endometriosis.
Yeah. I think because I know how this journey goes, I think it really gives me an insight into just how mentally just let me just take this one through my own experiences and struggles. I really realized this setup, this process is flawed on almost every single level. And it is not helping. It is a very short fix for a very long life. And it's time for a change. We know this. We know how women's health is, perceived and dealt with on a whole is a joke, let's be honest. And I think it's really time for a shift in how we're dealing with this. I think for me personally, it really started with that love, but more so than anything, it was education and it was practicing presence with my body through menstrual cycle awareness. Those two things. So if you're mixing menstrual cycle awareness and really getting to know yourself on those really small, quiet levels that actually turn out to, they're like small whispers that have these big messages. And if you really educate yourself on what is actually going on, and unfortunately we have to because our doctors don't. I have had a doctor Google endometriosis in the room. Yeah.
Oh my God.
So when we educate ourselves, like you can't do anything without the full picture. So once we educate ourselves on what we really need to do, how we can actually help our body on all these different ways, all these small ways, all these big ways, long-term ways, we can take our power back. We can accomplish what we're going to the doctors to get and essentially not getting. And I think for me, more than anything, obviously like stopping debilitating pain every month and just all of these symptoms that really were like ruining my life. More for me was just learning my body and loving my body. It really was. Because I'm sure that people will relate to this. I used to beg doctors in my early 20s, beg them in tears, please just give me a hysterectomy. And I've actually been laughed at. Oh, honey, you're so young, you'll change your mind. And oh my God, that is infuriating to think that I am not in control of what I want. I'm just a woman. Who knows what simple girl. She'll change her mind down the road. Yeah. Sorry, it's just like a little triggering, I guess. When we're educated, we're empowered, we make informed decisions, and we can turn around to doctors and say, no, that's not good enough. No, I don't feel comfortable with that. No, I don't want to go on medication. Now, that's all to say that you can actually even afford this, this surgery. So I've spoken to women throughout the world, and a surgery without like uh, Medicare that we have in Australia, and oh my God, thank you, Medicare, it can cost anywhere from I think $1,200 to $70,000. Yeah. So I was speaking with a woman last night who pays $600 a month USD insurance so that she could then go and have the $70,000 laparoscopy surgery. So that's, yeah, and I'm jumping back and forth here, but for me, circling back, what really helped for me, honestly, and this is a little bit stepping away from what the doctors were telling me, learning myself what works for me, what doesn't, and learning to love myself through it all, even when I have flare ups, even when I can't show up with a smile on my face to my friend's wedding. Like last weekend, I was in the toilet throwing up because I had pain so bad at the wedding. And that's not actually that usual for me anymore. But I loved myself through it. And I said, okay, you've been stressed. So we're not going to play that blame game of you've done something wrong, you've done this. It's like, you've been really stressed. You probably saw this coming. And just that communication with your body and like with yourself, it's so crucial to changing how we deal and how we feel. So,
Oh, thank you for sharing. That's so incredibly powerful. And just really what I really admire about you, Amy, is, you've been like every woman who's lived with this, I'm sure, been through this real journey of, looking for answers, wanting support, being completely and utterly broken down mentally. I can imagine in that sense of like, there's nothing wrong with you, being laughed at, being ridiculed and gaslit. And that's made you into a really strong woman who is really listening to yourself now, who's really taken charge and said this is just not good enough. And as much as you're here to advocate for yourself and for others and to support women into this place of sovereignty, this place of I'm not going to hate on my body or blame myself because of all of these symptoms that other people just don't understand because they have not lived through it. And I feel like I have to just fight for myself at every turn. There's that, but there's also the beautiful honoring that you do all the time, constantly in these moments, like you've had this morning when you were sick last night, of like, okay, I could let this shut me down again and put me back in a box, and it could really, really dominate your life and really affect your quality of life. And not saying that it doesn't. It's in that moment, that decision of like, how am I going to work with this? Like, this is real and this is true and this is happening, but how can I love myself in these moments to just, whether that means stepping forwards and going to do the thing or retreating and saying, no, I need time and space, whatever it is, but just loving yourself no matter what your choice is, no matter what you need in that moment. And I think that is so incredibly powerful. And it's that real like mix of strength and softness because it's coming from that place of I'm not abandoning myself on the inside. And I think that is such an incredible gift to women, to, for all of us, like you said, more broadly, because as you said, the way women's health has been treated is a joke broadly. We could all learn so much from that, but really specifically living with this condition that I just can't imagine what it would be like, to be able to have that within you, that safety to turn to within yourself of like, I'm here and I'm listening and I'm loving you and accepting you, body, for all that we're going through. I think that's just profound. Yeah.
it feels profound. And it's such an amazing alternative to expensive, extreme, you know, treatments. And I say treatments, we're excluding surgery from treatments, but yeah. And I read through these endometriosis pages. I read through these women saying, my doctor wants to put me on this pill, but it's like crazy, right? And it's going to send me into early menopause. And I'm like 25. And like, what do you guys think? And everyone's like, oh my God, this pill totally destroyed my life. Like it was even worse than the endometriosis things. And then by that time, there's so much damage. We've lost relationships, we've lost jobs, we've lost opportunities. And it just, yeah, it just needs to stop. It needs to change. And I'm wholeheartedly for, yes, do, if you're experiencing all this pain, do go and try and get that surgery. If if you really feel like that's something that you need, do it. And having that diagnosis can change how the medical system looks at you, not in a huge way, and how they treat you, not in a huge way, but it does change. You can just walk in instead of, I'm so much pain, I don't know what's happened. It's, I have endometriosis, I'm having a flare. And they say, okay, well, we know how to help you to an extent, without, we'll try not to bully you into taking the pill. But yeah, I think we need to just step away, and we need to like really just take our power back and say, this is my body. This is my unique experience. I don't care if I don't fit into some box of what the symptoms should be, endometriosis or not, I'm suffering. Help me. And then we can turn around and we can look at this on the micro level. What are we doing daily? What are our habits? What are things that we can do for our body? What worked? What didn't? All of this exploration. I know it sounds like a band-aid against like medical help, but it was the only thing that saved me. Like it really saved me.
It actually sounds the other way around to me. Like the surgery is sort of the band-aid in a way, because it's not actually fixing the problem.
You're
Whereas this
right.
deeper work is the dealing with that more root issue, and like creating safety, reducing pain. What you said about meeting pain, and the research that's been done to support that. This kind of work is the deeper work, and maybe it's in combination together with surgery. Maybe one is for you and you're being really called, like you said, to go and pursue that. But this is the kind of work that I know from the work that I do with women as well, not necessarily with endometriosis, but this work of reclaiming our body as ourselves. Because, when we reject our bodies, we are rejecting and abandoning and, making our bodies and ourselves the problem, instead of going, hey, I'm not the problem. The way you're actually acknowledging or not acknowledging me, that's the problem. As you said, I'm in pain no matter what. I'm in pain. So why are we not entitled to the help? And we know that when men are in pain, they get listened to and heard and responded to very differently. And yet the woman is just expected to endure. So,
Yes.
Amy, tell us about your program.
Yeah. So I will be very soon, we'll be releasing a 4-month group program. It's a group container for people. And I really want to emphasize this: endometriosis or not, come as you are. If you experience any type of symptoms that are, just beyond your normal period symptoms, this is for you. So basically, it's broken up into the 2 months with a bit of a holiday in between over the Christmas break, so that we can all go and enjoy our time off. The first part is menstrual cycle awareness. It's really understanding what our bodies are going through every month, all this work that we do, how you can really tune in, and massive emphasis on really getting to know your body. And then the second half is, of course, how we heal our endometriosis ourselves naturally through education, empowerment, and self-advocacy. And yeah, it's basically all the things that I've been through, over the past 15, 16 years, and all the research and all the doctors, all the things. I've put it all together. And I want to really help women work through their endometriosis and their pelvic pain and their symptoms in a real, long-lasting way, because we fucking deserve it. And I'm sick of not having it. And this is why I'm doing this work, because I decided I was sick of it. I decided that in a hospital room, actually.
Whew. I really feel that. That is so powerful. Thank you so much for the gift of bringing this through, for yourself, for others because you deserve it and it is time. And if nobody else is going to do that in a real meaningful way, you're here to do it. So how can women find out about the program and connect with you?
Yeah, so my Instagram is a really great place to start because it has all the links. But you can also jump over to my website and have a look through a bit more information of that group program and container for what it really will dive into over those months. So my website, I can give it to you now, and you can, yeah. So it's www.sacredflowcoaching.com, and my Instagram is just Sacred Flow Coaching, all one word. So yeah, you can pop over and jump on that. I've got lots of other information as well on my website, just how to help with period pain naturally and my journey with endometriosis. It's all probably a little bit clearer than my very passionate, all over the place conversation.
Love that. Thank you so much for sharing. And yeah, like go check out Amy's work. She shares amazing things on Instagram and has got those resources. So go find out what she's offering. And I just know how potent this program is and your work is. And I'm just so excited that people have options, options to take back their power in a way that's like, I'm going to do this, as you said, something that is long lasting and meaningful and root cause focused. So I'm just so thankful for you doing this. Thank you so much, Amy, for your time and for showing up and sharing with us. And may your transition at this point of your cycle be as easeful as possible. Just thank you so much. Sending you love. Thank you.
Thank you so much for having me, Charlotte. I'm so stoked to be on the podcast. That was my Bible. So, so happy to be here. And yeah, thank you so much for holding me today, even though I was a little bit crazy.
No, you're just amazing as you are. Thank you so much. Thanks so much for listening to Wild Flow. I love having you here and hope you loved this episode. If you did, please show your love by leaving a rating and review and share your fave episodes with your cycle and biz sisters and those who haven't yet discovered the power of their body and cycle. This is how we collectively create change and heal the sisterhood. It makes such a difference. Thank you for sharing. Haven't discovered your cyclical leadership style yet? Take my free Much Love quiz now to receive your free in-depth playbook on how to up your sacred leadership, grow your business, and thrive by embodying your cyclical archetype. Go to charlottepointo.com/quiz now. Until next time, be devoted to your body as guide and your cycle as oracle.